My name is Chase Henderson. I am a general surgeon here at HCA Florida West Hospital. I mainly perform abdominal surgery. We also do some breast surgery for breast cancer, as well as a little lump and bump if you have a little, small mass on your arm or a little cyst. We also do EGDs and colonoscopies for screening for cancer, for colon cancer, as well as acid reflux and hiatal hernias. We do a lot of hernia work, specifically for me, robotic hernia work. So really dedicated to minimally invasive surgery, small incisions that increase the post-op recovery rate so that you're not as restricted as long as you would be with an open surgery. I do think that robotic surgery also gives us more precision so that we can be more accurate with where we put our stitches to make sure that they last as long as they can. And it also gives us the best visualization that you could ever find. If you think of a big HD TV watching a football game compared to the old big boxes that were in the living room that took 4 people to carry into the house, that's kind of the difference that we're talking between laparoscopic and robotic surgery. I think that a lot of people do surgery because they enjoy the surgery itself. I think that's the main driver for a lot of surgeons. I do enjoy the surgeries, but I think more so than the procedure itself and working with my hands is the relationships that I make with the patients. You know, the greatest part about my job is being able to help these people. And when they come back after surgery, some people, for example, someone comes in and they haven't been able to eat anything for a month. They can't eat. They drink, they can't eat, they can't do anything. Every time they do that, it causes terrible pain. And I take them to the OR for an hour, fix their problem, they come back 2 weeks later, and it's like they didn't know how good they could feel. When I meet with patients, I would say there's very few that come in that are not anxious about surgery, and I think that's appropriate. I think that surgery is something that we don't experience frequently, or we hopefully don't experience it frequently, and relieving those fears and relieving that anxiety. And I've found that talking with the patients, discussing everything, listening to their questions, answering their questions, and trying to give them all of the information so that they can make the decision on what they want to do going forward, I find is the best way to go about it.